The immune system. Thyroid autoimmune diseases. Thyroid autoimmune diseases. Graves' disease is an autoimmune disorder. Normally, the immune system protects the body from infection by identifying and destroying bacteria, viruses, and other potentially harmful foreign substances. But in autoimmune diseases, the immune system attacks the body's own cells and organs. With Graves' disease, the immune system makes an antibody called thyroid-stimulating immunoglobulin, sometimes called TSH receptor antibody, that attaches to thyroid cells. TSI mimics TSH and stimulates the thyroid to make too much thyroid hormones. Sometimes the TSI antibody instead blocks thyroid hormone production, leading to conflicting symptoms that may make correct diagnosis more difficult. Hashimoto's disease, also called chronic lymphocytic thyroiditis or autoimmune thyroiditis, is also a thyroid autoimmune disease. In Hashimoto's disease, the immune system attacks the thyroid gland, causing inflammation and interfering with its ability to produce thyroid hormones. Large numbers of white blood cells, called lymphocytes, accumulate in the thyroid. Lymphocytes make the antibodies that start the autoimmune process. Hashimoto's disease often leads to reduced thyroid function or hypothyroidism. Hypothyroidism is a disorder that occurs when the thyroid does not make enough thyroid hormones for the body's needs. Thyroid hormones regulate metabolism, the way the body uses energy, and affect nearly every organ in the body. Without enough thyroid hormones, many of the body's functions slow down. Hashimoto's disease is the most common cause of hypothyroidism in the United States. Graves' disease symptoms. Goiter is the enlarged thyroid. There's trouble sleeping, irritability or nervousness, increased sweating, and rapid heartbeat and palpitations. People can also have muscle weakness, weight loss without dieting, and some can get eye problems where the tissue behind the eyes becomes inflamed and swells. Also, reddening and thickening of the skin are often on the tops of the feet. Hashimoto's disease symptoms are fatigue, weight gaining, their pale, puffy face, chills, and slowed heart rate and low blood pressure. People can also get depressed easier, get thin hair, and get an enlarged thyroid. How is the disease diagnosed? For both Graves' and Hashimoto, the physical examination, medical history, blood test, and thyroid scan can be used. For Graves', there is low TSH below normal range from 0.5 to 5. Normal to elevated levels of T4 and elevated levels of T3. Radioactive iodine uptake test. This test measures the amount of iodine the thyroid collects from the bloodstream. High levels of iodine uptake can indicate Graves' disease. TSI test. Healthcare providers may also recommend the TSI test, although this test usually isn't necessary to diagnose Graves' disease. This test, also called a TSH antibody test, measures the level of TSI in the blood. Most people with Graves' disease have this antibody, but people whose hyperthyroidism is caused by other conditions do not. For Hashimoto, there is high TSH, which is above normal range from 0.5 to 5. The level of T4 in the blood is lower than normal. Anti-thyroid antibody test. This test looks for the presence of thyroid autoantibodies or molecules produced by a person's body that mistakenly attack the body's own tissues. Having TPO autoantibodies in the blood means the body's immune system attacked the thyroid tissue in the past. Most people with Hashimoto's disease have these antibodies, although people whose hypothyroidism is caused by other conditions do not. Treatment. For Graves', radioiodine therapy is the most common treatment for Graves' disease in the United States. In radioiodine therapy, patients take radioactive iodine-131 by mouth that gradually destroys the cells that make up the thyroid gland, but does not affect other body tissues. Healthcare providers may prescribe a medication called a beta blocker to reduce many of the symptoms of hypothyroidism, such as tremors, rapid heartbeat, and nervousness. But beta blockers do not stop thyroid hormone production. Surgery is the least used option for treating Graves' disease. Sometimes, surgery may be used to treat pregnant women who cannot tolerate antithyroid medications, people suspected of having thyroid cancer, though Graves' disease does not cause cancer, people for whom other forms of treatment are not successful. For Hashimoto, healthcare providers prefer to use synthetic T4, such as Synthroid, rather than synthetic T3 because T4 stays in the body longer, ensuring a steady supply of thyroid hormones throughout the day. The thyroid preparations made with animal thyroid are not considered as consistent as synthetic thyroid, levothyroxine, and rarely prescribed today. Prognosis of Graves. If left untreated, Graves' disease can be fatal. In most cases, however, normal health can be restored with treatment. Most patients become hypothyroid and require replacement. Similarly, the ophthalmopathy generally becomes quiescent. On occasion, hyperthyroidism returns because of persisting thyroid tissue after ablation and high antibody titers of anti-TSI. Further therapy may be necessary in the form of surgery or radioactive iodine ablation. Prognosis of Hashimoto. The outlook for those with Hashimoto's disease is good. While long-term thyroid hormone replacement therapy will likely be needed, with regular blood tests and monitoring of symptoms, side effects are minimal and the long-term prognosis is good. Graves' statistics. Both men and women can get Graves' disease, but it affects women 10 times more often than men. Occurs in people of all ages, but most often starts in the 20s and 30s. People who get Graves' disease often have family members who have thyroid or other autoimmune diseases. People who get Graves' disease sometimes have other autoimmune diseases such as vitiligo, lupus, rheumatoid arthritis, or diabetes. Hashimoto statistics. It can occur with or without hypothyroidism and Addison's disease. Women are 7 times more likely to develop the condition than men. Women between 40 and 60 years old are most likely to develop this condition. The condition may be hereditary. Points to remember for Graves' disease. Graves' disease is the most common cause of hyperthyroidism in the United States. In Graves' disease, the immune system stimulates the thyroid gland to make too much thyroid hormones. Graves' disease is most often treated with radioiodine therapy, which gradually destroys the cells that make up the thyroid gland. Antithyroid medications and surgery to remove the thyroid are sometimes used. Points to remember for Hashimoto disease. Hashimoto's disease, also called chronic lymphocytic thyroiditis or autoimmune thyroiditis, is an autoimmune disease. Hashimoto's disease often leads to reduced thyroid function or hypothyroidism. Hypothyroidism is a disorder that occurs when the thyroid doesn't make enough thyroid hormones for the body's needs. Hashimoto's disease is the most common cause of hypothyroidism in the United States. Many people with Hashimoto's disease have no symptoms at first. As the disease slowly progresses, the thyroid usually enlarges and may cause the front of the neck to look swollen. Hashimoto's disease, with or without hypothyroidism, is treated with synthetic thyroxine, which is man-made T4.